This patient came back to see us for endodontic retreatment of tooth number 20 now. We redid the root canal on tooth number 18 about 2 months ago, and patient reported today that all the symptoms associated with tooth number 19 had gone away already. So she came back to see us today so we can work on tooth number 20. So take a look here. PFM crown, prefab metal post, previous root canal, and a nice size periapical with lucency here. Patient has symptoms today. She says she was glad she was here at our office because the tooth was hurting her a lot. So today we went through the PFM crown, removed this prefab metal post, and this is it. This is the post. Take a look here. You see that dark black film on this post, prefab metal post? This is all, if you had an electron microscope and you could put this film under the microscope, you would have been able to see all kinds of bacteria growing on that. That tells me that this dentist probably didn't use a rubber dam while they did the root canal, so saliva and bacteria, they got all kinds of coronal contamination as they were doing the root canal or as they were putting the post in and building the tooth back up to prepare it for a crown. Anyways, failed root canal here. So remove this prefab metal post that I just showed you, remove the gutta percha. I use chloroform for that, and take a look here. And here's the post-op. So the apical diameter turned out to be 55, and in cases where the apical diameter is 50 or larger, I prefer to use MTA. MTA gives a much better apical seal in larger diameter canals versus gutta percha and sealer, especially when there's an infection. The apical diameter is the root, actually, the apical part of the root is affected. It's chewed up by the infection, so it's not uniform. It's not nice and circular like that. It's all chewed up. So the MTA can mold to these areas where it's not uniform, mold much better versus gutta percha and sealer. So you can get a much better apical seal. This is white MTA followed by gutta percha and sealer, and I went ahead and temporized the tooth and referred the patient back to her dentist for the permanent restoration.